After your planned surgery, we also provide physical therapy and aftercare because I think combining surgery with a right physical therapy is a key point to a successful healing. So when you are discharged from the hospital, you can go to any vacation site like Çeşme, Seferihisar, Kuşadası or Foça, and our physiotherapists will keep taking care of you in your hotel or wherever you are staying. You don't have to go to the unit itself. They will come for you. And if it is a 10-day or 15-day accommodation, your physical therapy will also be held during this time, and you will turn to your home much more better, not only having your surgery but also having your physical therapy. When we are talking about bursitis, we generally talk about a tissue that is between a fascia and bone or muscle mass, so that restricts friction. And if there is too much friction around this area, this bursa gets bigger and it starts to cause pain. And if this irritation gets longer in time, the body stops healing that area, and this bursitis becomes chronic. In this scenario, we generally do multiple treatments and a combination of treatment modalities together to heal the area, which can be cortisone injections, PRP injections, kinesio taping, as well as physical activity modifications and some muscle rehabilitation protocols. But in some patients, in rare cases, we can also recommend a surgery to relax the friction area of this irritated bursitis. When we talk about sports surgeries, there are two types of sports surgeries. One is that we treat without any surgical intervention, and the second one is we generally recommend surgery, which are meniscus tears, cartilage problems around knee, ankle or other joints, and also ligament injuries like anterior or posterior cruciate ligament injuries. And in these surgical treatments, we generally do arthroscopic interventions so that there will be minimal tissue damage to the injured extremity or joint, and one can return to sport as soon as possible. In this case, for example, for meniscus tears, return to sport time is generally 2 to 3 months. And for ACL injuries, we recommend returning to sports not earlier than 9 months, if possible 12 months, because the ligamentization of ACL is taking this 9 or 10 months. Before this, if the patient returns to sport, it is very possible that he will re-injure the ligament again. Generally talk about a general concept, which the injuries that occur during any sport we are doing. These can be tendonitis, muscle cramps, muscle tears, meniscus tears, as well as ankle sprains and many fractures, stress fractures, occult fractures. These are all considered to be sports injuries, and these injuries may vary according to the sports you are doing. When a sports injury happens, especially when an ankle sprain or a muscle tear happens, the first thing to do is to put ice for about 10 minutes to the injured side, and then elevate the injured extremity for about 10 or 15 minutes. And after that, you should rest the injured side for about 1 day. And if your complaints are still bothering you, then you should see a sports doctor as soon as possible. When we are treating sports injuries, especially muscle and tendon problems, we generally use combination of treatments like PRPs, collagen injections, mesotherapeutic agents, and also bandaging and taping around the injured extremity or muscles so that one can return to sport as soon as they feel right about it. Can chronic problem occur again after healing on itself? Yes, this is possible. We especially see this in ankle sprains. Ankle sprain occurs. It takes about 2 to 3 weeks for the sprain to heal itself. But when you don't give right physical therapy, the injured ligaments around the ankle will not heal properly. So once
the person returns to sports, he will have this injury again and again. So it is very important to give right physical therapy, especially for anatomical and physiological strengthening of the injured ligament. We talk about kinesio taping, especially in sports injuries. We generally recommend this type of treatment for muscle soreness, tendonitis, or other muscle and tendon problems. This elastic taping helps the muscle mass stretch easier, and also the elongation of the muscle will be prevented by this elastic taping, so that the forces on that muscle body and also on the tendons of that muscle will be taken by the band we use, and this will help the patient feel better, move better during his or her healing process.